So we are here celebrating 100 years of one such drug which has changed probably the way entire mankind lives. We are talking about the invention of insulin. Imagine the era where there was nothing available for diabetic patients. The only way to manage diabetes patients was to put them on with a calorie restricted, energy sparing diet. Where many local remedies tried, home remedies tried, traditional remedies tried, parallel medicines tried. Nothing was working. The treatment was horseback riding. Some thought that it is an energy loss through urine. So really supplement high energy diet, high carbohydrate diet. Everything was tried. And then it's still taking time. But unfortunately nothing worked. And you will be surprised. It's still downloading at the... I know that the file size is a little larger. But let me tell you that every intervention failed. And it will not be a surprise for you if I tell you that somebody who had type 1 diabetes, imagine your children. One of the child has type 1 diabetes. What was the expected life of the patient who has been diagnosed to have diabetes? Type 1 diabetes during that time?
7 to 10 years.
7 to 10 years. Anybody else? I am talking about 100 years ago, before the invention of insulin. Anybody else would like to give a try? Perfect. Thank you. It was 6 weeks to 6 months. Imagine the time when a type 2 diabetic patient used to get a diagnosis. The life expectancy was 6 weeks to 6 years. That's what you are talking about. So here I am going to take you back to the history. Here I am to take you in a time machine which will take you back, travel 100 years ago, to live together, all of us. What must be the scenario? What has happened? How the invention occurred? What these guys thought of? And what everybody was thinking about. So before I do that, these are some brain teasers. Write down, just write down and keep your answers ready. I'll be answering them all. These are the teasers for your brain. And let us start. A story which actually not began 100 years ago, much beyond before that, but the invention happened 100 years ago. So this is what I talked about. Before the insulin discovery in 1922, the chance of survival for a type 1 diabetic was absolutely zero, 100% mortality. And these were all the remedies which were tried. And these are all lock and key remedies. Everybody was trying their own styles. Look at the different, ways of syrups and cuffs and alcohols, and everything was there. There were multiple dietary advices. There was a very famous traditional diet which was called as a Freddie Allen diet. There were two very prominent diabetologists practicing that time in the United States. Dr. Elliot Jocelyn, you all have heard of him, and Dr. Freddie Allen. And look at their diets. They were very calorie restricted, low carbohydrate diet with very high amount of exercise. And I'll give you an example of what their diets look like. This was what the breakfast looked like. This was what the lunch looked like. This was the snack. This was the dinner. How much was the calorie count? 450 calories. And this is the reason why these patients, look at the children. These are the pictures. I know some pictures would be disturbing for the audience, but look at the children. Look at the way the patients were. They really lost flesh. They melted flesh. And they died of what? They died of lack of nutrition, ketoacidosis, air hunger, gradual onset coma, and ultimately death in a period of weeks to months depending on the type of the diabetes that you had. And then came the Bintix miracle. A miracle that has changed the life. So this is the story that I'm going to tell you. A story of miracle, a story of hope, a story of life, a story of drug that has changed the entire mankind. And even today I proudly say that the only drug which has been celebrated on all the platforms, at all the pharmacopoeias, at its highest. Insulin is still currently the highest studied drug in any pharmacopoeia. Let us talk about the discovery of insulin. 100 years. Let us celebrate this together. Friends, I am Dr. Mangesh Tiwaskar. It was not unknown that diabetes and carbohydrate metabolism and pancreas there was a good work which was done by a lot of researchers. Like right from the days of Paul Langerhans, who actually demonstrated that there is something called as islets. He could not name them as islet of Langerhans. It was actually his student, Gustav Logis, who was responsible for naming the cluster of the cells which were special, which were seen in pancreas as islets. In fact, you will be surprised that it was Gustav Logis who was also responsible for coining the term endocrine for the first time. And then all rest of the scientists and researchers working on carbohydrate and diabetes metabolism, everybody was talking, because this disease was 100% fatal. As we talk, everybody of us talk, whenever you are physicians, you talk about currently, when you talk about diabetes management, you talk about SGLT2 inhibitors, you talk about GLP analogs. That time, people used to discuss and talk about carbohydrate metabolism. They used to talk about the relation of pancreas to blood sugars. And a lot of people, including Eugene Upai, Sterling, in fact, Jean D. Mayers, very interesting characters. Look at the people, their thought process. Jean D. Mayers and Sir Edward Sheffy Schaeffer were the people, those who knew that there is something in pancreas. And even before the discovery, they have already coined the term insulin. The drug was not known, the drug was not discovered. In fact, Dr. Sheffy Schaeffer was such a brilliant guy that he knew that there is something called as pro-insulin before. So after the discovery of insulin, pro-insulin, something like that exists in the pancreas, and the way the insulin is secreted was discovered 50 years later on of the insulin discovery. But this man thought about the term pro-insulin 50 years before the discovery. Now look at the geniusness, look at the thought process. There were few people like Dr. Zulzer, Dr. Ernest Scott, Dr. Israel Klizner, and most importantly, the closest to them was Dr. Nicolae Polosk, a Romanian scientist who was almost certain. He tried the injections of the pancreatic extract, but somehow could not sustain the effect. The patient developed serious life-threatening reactions, so he could not prove it. And unfortunately, after he was to publish his invention, First World War started and his laboratory got destroyed. And the chance was robbed. So I always call them as well-trained guys. And these are the publications that, there is an evidence in the literature. These are the publications when they talked about the internal secretion of the pancreas. But then came the miracle which was done by the splendid quadrate, Frederick Grant Benting, Charles Herbert Best, John J.R. MacLeod, and of course, James Collin. These people changed the way we live today, and we owe a huge thanks to them because they gave us insulin. The main credit goes to an army, underqualified, a very, very hot-headed mama's boy, orthopedic surgeon. Imagine, an orthopedic surgeon. Just like COVID was discovered by an ophthalmologist, right? So, an orthopedic surgeon, Frederick Grant Benting. Let's talk a bit about him. He deserves a little attention. Born in Alliston, Ontario, a farmer's son, a typical mama's boy, left for education to Toronto at the age of 20. Now look at the irony of the fact. He got admission first in the arts college. He did not do well in the literature, so he dropped off and then joined medicine. This is what was the truth. And because of the World War, his training was turned into a crash course of 15 months, and he got trained into orthopedics and was sent to the war front immediately as a war surgeon. Got injured, naturally, somebody gets injured in the war and is not able to work, has to leave the war. So awarded an Army Cross, sent back. I told you that he was a mama's boy. He used to write down the letters to mama. This was the letter that he wrote to mama when he got injured. And he writes down there, "My dearest mother, this letter will be a short left hand. I was slightly wounded yesterday in the right forearm. I had an operation last night and a sharp nail size removed from between the bones. No fracture, but ulna is little damaged. I feel pretty good, only tired. I am just had a big, good meal which was very happily taken. Everybody is sort of a how are you kinda. I am the most luckiest boy in the France because I don't know where we are going to go. I am staying in the war train hospital. Don't worry, I'll be fine." This was what Frederick Grant Bentinck writing down to his mummy from the war front. So ultimately when he won the cross and he was injured, he was sent back to Toronto. Board thought of started practicing. So in London not in UK, London is a city which is close to Ontario, around 100 miles from Ontario. Started practicing in London, but surprisingly London went cold on him, just like me, Agam, I am not like Agam, He saw only one patient in 28 days. Got bored, decided to join a medical college. कुछ तो करना पड़ेगा, खाना है. He had purchased a house. So he thought that let me join a medical college. He got the post of physiology trainer. A trainer, a support assistant to a professor of physiology. And there was nothing to do. But he had some interest in diabetes basically because he lost his classmate, Jenna Victoria Jennings, to type 1 diabetes. And to her coffin, he was a pallbearer. You all know who is a pallbearer? Are you aware who is a pallbearer? Pallbearer is the one who carries the coffin, holds the coffin. He lost his very close friend because of that. So he had that interest. His professor Miller, Dr. Miller, told him that now you need to have a training tomorrow and teach the students carbohydrate metabolism. Look at the orthopedic surgeon. So started reading about it. Somehow this was August 31st night, middle of the night, 2:30 a.m. He got stuck with the idea. While going through a publication by Baron Moses, he started looking at the literature and that struck an idea where Moses was talking about the ligation of the pancreatic duct, degeneration of the acini, allow the islets to survive, and look at the change in the physiology of the pancreas. This was the aim. And he was talking about the patients, those who had a pancreatic stones or lithiasis. That has struck the idea. Unable to sleep, tossing in bed. It was around at 1:50 a.m. in the morning. This was the paper which he got inspired. And this was Moses Baron paper which he got inspired. And this was the place. This is still there in the Bentinck's memorial. You go and visit this place. This place still exists. And this is his own handwriting. And he wrote those 25 magical words in the history of medicine. Diabetes. Ligate the pancreatic duct of the dogs. Keep dogs alive till their acini degenerate. Leaving islets. Try to isolate the internal secretion to relieve glycosuria. Now while I was making the transcript of this write-up, I did realize a couple of things. Look at the spelling of diabetes. He spelled it wrongly. That is what orthopedicians are. Look at glycosuria. The spelling of glycosuria. He placed it wrongly. But that was an aha moment. That was a moment where he got excited. So next day morning, he ran to Professor Miller. And Professor Miller said, yeah, brilliant idea. But unfortunately, we don't have a setup for that. You need a laboratory. You need animals for experimentation. We don't have a physiology lab which is so well researched, armed for your research. So go to Toronto. I have a friend there, Professor John J.R. MacLeod. He is the #1 currently in the carbohydrate metabolism. Go and meet him. He called up Dr. MacLeod. And ultimately, when Bentinck was visiting the marriage in Toronto for the marriage of his cousin, a meeting was set between them on 6th of November 1920. This is the Toronto General Hospital that time looked at. And the Department of Physiology was on the 2nd floor. And the meeting was set between John J.R. MacLeod, a champion Scottish physician, not physician, a biochemist. He was not a qualified medical doctor. He was a biochemist, but had a massive work in the carbohydrate metabolism. He had published monographs. He was supposed to be one of the final authorities in carbohydrate metabolism. And Benting describes the whole event like this. He presented his work to MacLeod, saying that this is my concept, sir, that let's have two sets of dogs. One set of dog will ligate the duct of the pancreas and allow the acini to degenerate. And the second set of dogs will depancreatize them, will do a pancreatectomy and make them diabetic. And then from those dogs where you have done the ligation of the duct and acini are degenerated, take out the extract, inject to the diabetic dogs, they are relieved. We know that we have something. But you know how the physicians and the biochemists look at orthopedicians. Same way MacLeod's attitude was there. And Benting write down in the script of insulin discovery, the story of insulin discovery. Look at this. My interview with Professor MacLeod lasted for 1 hour. I told him carefully that I had planned, and to my disappointment, he seemed to be not interested at all. He always kept on offering me, boss, ye nahi ho sakta hai. It is not possible. He asked me very probing questions, and that time MacLeod was working on the hypoxia theory. So he asked very difficult questions to Frederick and Benting. And you know that, orthopedicians cannot answer these kind of questions. So he went quiet. Benting kept on pursuing. MacLeod sat back. And what was most disturbing for Freddie was the statement, okay, I might think about giving you a chance because negative results will be of a great value. It will seal that all debate between the pancreas, the carbohydrate metabolism, the association of pancreas to the various metabolic challenges. It will stop everything. That debate will end. I am sure that there is nothing like, the connection between the pancreas and the carbohydrate metabolism. So what he said was that the negative results would be of a great physiological value. Damn upset. He came back. Freddie came back, disheartened, started practicing again. But surprisingly, his practice started doing well. MacLeod promised him that, sir, I'll come back to you, I'll give you, I'll write down to you. He did not expect his, communication. But 3 months later on, MacLeod wrote him, and he said that, okay, I'll give you a chance. Probably he must have discussed with some of the fellows, and he said, yeah, okay, fair, I'll give you a chance, come down, but you cannot stay at London and do a experimentation in Toronto. You need to come here and stay. There is a dilemma. My practice is doing well. How can I leave my practice and start and go back again? So that was a difficult time. But then he said that no, these kind of experiments will require your presence 24/7 here. And you can start your experiment somewhere at the end of mid-May, because otherwise, that will end the holiday season and the people will be more available there and they will be attentive. And my students will be definitely of assist to you. In the meanwhile, before the letter was, sent to Freddie applied for a job in an oil company as an expedition doctor. And then he received the letter. Dilemma. Kya kare? For the first time, Freddie tossed a coin. The expedition won, but unfortunately the expedition did not call him only. By the time Freddie got engaged, his wife was so stubborn that he should not leave London now because he is doing well in practice. He is going to get married. Don't go, you will not earn there. But Freddie was so much convinced with his idea that he broke the marriage relation. He broke the engagement and went to Toronto. And he was given 2 geniuses, youngsters, by name Edward Clark Noble and Charles Herbert Best. These were the 2 biochemist students. They were doing honors in biochemistry under Professor MacLeod. And he started, Benting told them that he is Freddie Benting. He is going to do some experiments for you. You both have to work with him. Noble was not very convinced about it. He was not interested. But Best was okay, because Best also had one of his aunts dying because of type 1 diabetes, and he had a research interest in carbohydrate metabolism. So ultimately, McLeod told him that I'll give you 6 weeks and 10 dogs sanctioned. Within 6 weeks you do your job, otherwise you are through. I am putting you off. Who will work first? So again the toss of coin was done. Now who won the toss? There are mixed reports which are available, but it was Charles Herbert Best who was the first one to start working in laboratory with Benty. And he was a guy who was doing undergraduate students, graduates in biochemistry. And it was Toronto General Hospital, second floor, room number 221, the operation started. They have started operating. They started operating dogs. The moment they performed pancreatectomy, 2 dogs died. McLeod told them that, boss, you need to learn how to operate now. The Freddy's responsibility was to operate, and Best's responsibility, being a biochemist, to do the sugar estimations, to do the calorie estimations, to do the electrolytes, and find out about the hydration of the dogs. Benty was to go for the summer holidays to Scotland. He was a Scottish physician, and Toronto was very hot that time. 2 dogs died. McLeod come in and taught them what is called as a Haydon's method of pancreatectomy. And they started operating. They learned Haydon's pancreatectomy, and then they started writing down the dog diaries. There are so many dog diary notes which are available. And they used to write down, you can see here that urine was loaded with urine, dog is semi-conscious, dog died during the night. So these were the notes which are still available. These are the diary photos which are there, and some of them I have personally took them when I was visiting the museum. And it was 30th July 1921, which was a eureka moment. It was dog number 391. Remember, dogs were not numbered serially, they were numbered randomly. So it was finally dog 391 with the degenerated acini, and a pancreatectomized dog 410 was already available and who was diabetic. So an extract was taken from dog number 391, was injected, and the sugars for the first time dropped from 200 to 120 milligrams. First demonstration of the effect of pancreatic extract. This was the notes you can see on the dog diaries. These are the notes which are there. Further experiments could not be possible because next day morning dog 410 died. Autopsy was not performed, they did not want to find out. But then, excited, McLeod was in Scotland, their boss was in Scotland, so they both wrote to McLeod. And Benting wrote whole this. These are all things that I have transcribed for you. I am not going to go through the entire details of the slide, but I'll just give you the nutshell of this. And he wrote down and see what he starts like. I don't know from where to start, sir. There are a couple of things which I have noticed. Number one is this, that the extract universally causes decrease in the percentage of the sugar and the excretion of sugar in the urine of the pancreatic dogs, diabetic dogs. The activity lasts for 4 days if it is preserved cold. Look at the thought process. And one more interesting thing he writes down, that the extracts of the spleen and liver I tried, it failed. I get sometimes mesmerized the way these people think. Way these researchers, how and what has made him to think that okay boss, मैं pancreas का तो देख रहा हूँ मगर let me try about spleen and liver also. What made them to think that? And he also said that, sir, now probably I need some more dogs. Now the dogs are not available. Believe me, they started stealing the street dogs from and couple of times Best was arrested. The cost of the dogs used to be $1 to $3 and they were not paid. Remember that, they were working free of cost in the laboratory. So imagine to survive. And they started writing down the notes. So it was very hot summer, so Benting decided that let us have a break for 15 days. They went back and came back and again started experimenting, because those were the days where there were no emails. The communications used to only occur by ship mails or air mails. So before McLeod's response arises, what to do? This is what they have decided. And they started again re-experimenting back, and then McLeod responded. This is the actual graph of the blood sugar and the urine sugar of both dog number 408 and dog number 92. You can imagine she was a yellow coolie who had absolute low blood sugars every time she was given injection for nearly 21 days. So it was almost certain to both of these guys that now we have something which is directly from the pancreas. And while they were treating this yellow coolie for 21 days, as there were no other dogs available, sometimes they have used the whole pancreas of the cat. Now here was I would say, a point that they have missed. And what was that? They realized for the first time that you don't have to degenerate acini at all. You can just crush the whole pancreas of a dog, of a cat, of a beef, of a fetal calf, and you can inject. So had they realized this, right, they would have said at least saved 50% of the dogs. But they realized it way later on. By the time MacLeod responded and say that you keep on experimenting, there has to be no mistake. Typical boss's attitude, as Deshpande madam will be like, it is very often easy in science to satisfy one's own self about some point, but it is very hard to build up a strong hold of a proof which others cannot pull you down. Such a pragmatic statement. This was what MacLeod was, and they kept on doing it. MacLeod come back, now Benting and Best confronted him. Sir, now we want better labs and we want pay now. We cannot work free of charge. So this was what, and MacLeod thought that okay, I have given you a laboratory free of charge, dogs, everything, you are utilizing university resources, I think that is adequate. So there were a lot of hot-tempered word exchanges. In fact, in history, if you really read properly, there is a mention that Freddie said that if you don't give me the salary, I'll look at some other place. University of the Toronto is not the only place that I am able to work. MacLeod told him that for you, man, I am the University of Toronto. So don't talk any bullshit. That was what. But then the tempers cooled down. MacLeod realized that these young people have achieved some feat. Let us respect them. So they decided to give them the retroactive salary. They gave a good lab, and that has motivated again our Freddie and Charles Best, and they started going to the laboratories as a good resident students. They started reading about it. But Freddie was an orthopedician, army brain. He was not into research and all that. He did not believe in that. He wanted his experiment now to be performed on the human beings. And that's why, on 14th of November 1921, Freddie's 30th birthday, they presented this to the physiology student, this concept. And there was one brilliant man called as Dr. N.B. Taylor sitting in the crowd, and he told him that please look at it and see to it that your experiment is long-standing. You need to prove the longevity. So 17th November, the famous Marjorie dog was operated. Marjorie, who actually gets the credit of being the first longest surviving dog after the pancreatic extract. And what was the duration of her survival? She survived for 91 days. That was too much. Toronto investigator now realized that they have something sure. But unfortunately, as there was no human experiment available, they tried to do something different to the extract. And what they did, that for preparing the extract, they used to use the cold ringer saline. Now they have started using alcohol. It evaporated very fast, and the extract and the crystals were available easily. And that's how the whole thing started. Now MacLeod also thought that yes, we have got something. So he decided to abandon his skepticism and wrote to his colleague, Professor Elliot Jocelyn, back saying that I may say privately, sir, that I believe that we have something real happening here. And this is what the whole thing happened. And then a friend of Dr. MacLeod, who was on the sabbatical for 1 year, a PhD in biochemistry from University of Alberta, Professor James Bertram Colin. He was there in his office and he expressed his interest to join the investigation, and that's how he got into the picture of insulin invention. Last 2 minutes. First human being who received insulin, we all know the credit was always given to J. Leonard Thompson, right? Those who are diabetologists practicing Snehal is here, he'll remember that the first human to get credit of getting injected was always in the literature J. Leonard Thompson. Was it? Wrong. I'll show you what there is in the literature. Look at the, I would say, magnanimity of these guys. On 23rd November 1921, both Benting and Best injected themselves with the small dosages of their own pancreatic extract. Imagine. Just to see to it that, the reports which were there by Nicola Polosk and and Israel Cleaner, that it causes an anaphylactic reaction. Imagine these guys, taking their own injections. So the first humans to receive were these both guys. And the first diabetic patient to receive insulin was not even J. Leonard Thompson, it was Professor Joseph Gilchrist, an army physician, again, who was diabetic. But the experiment failed because insulin was given to him orally. And this was the clinical notes which you can find in the literature, where Freddie writes down that on 20th December I phoned Joe Gilchrist, gave him the extract orally on empty stomach. It did not work, it did not cause any fail. But this Joseph Gilchrist ultimately became the brave heart because he was the first human subject for all the insulin clinical trials thereafter, whatever happened in the insulin research. Collip also received the remarkable feat. He improved the use, and ultimately insulin concept was presented on 30th December 1921, where Benting and Best declared their invention to the American Society of Physiology at the University of Yale. And people were big names. This was the registration chart of the Congress. As Amit has registered us with all our phone numbers and all that. These are the guys those were there. And look at the names. Elliot Jocelyn. There is one guy called as G.H.A. Kloh. He was the owner of Eli Lilly company. He was sitting there. But our men got royally bashed. They were thrashed. And very probing, difficult questions were asked. Like, why did you assume that the pancreatic physiology will change? Just on the one report? Did you measure the temperature of the dogs? Did you do the calorie count of the dog food? The basic hurting question which was asked was, you really did the pancreectomy completely, or there was some tissue of pancreas which was left back? And the last question was the most difficult to handle, was, how do you really convince us that your experiments will be effective for the human beings? These were probably poorly defended by JJR. He tried to convince people, but it was not convincing. Due to skepticism, due to insult, Freddie was badly insulted. His job was already on the stake because now beef pancreas was available. The cow and the buffalo pancreas was available. The pork pancreas was available. The cat pancreas was available. The rabbit pancreas was also available. So his job was done. Now as Collip has joined, Best's job was also done. So they thought that they are losing the importance in the laboratory. And one smart idea that probably Freddie had, that he was the only qualified physician. He was the only qualified, not physician, doctor in the entire team. So he'll get a job in the University of Toronto. So he thought that, let me have that, chance, and let me get a job here so that I can inject officially this extract to my patient. And it was Dr. Professor Graham who actually denied him the opportunity. 11th January 1922, a charity patient who was admitted under Dr. Walter Campbell, where the house physician was Dr. A.D. Jeffrey, and they injected 15 ml of pancreas. First shot, 11th January 1922. Nothing happened. In fact, sugar probably little dropped down to small amounts, but the patient developed an abscess, a sterile abscess. It was thought that the abstract is impure. Collip was assigned the job. Collip took over the job and he purified. And 15 days, day and night, this guy worked into the laboratory and purified the abstract further. And on 23rd of January 1922, Leonard Thompson gets the second shot and the miracle happened. The sugar which was 520 came down to 120. Glycosuria which was 71 came down to 9 grams. Ketonuria disappeared. And this is the record of the publication, which has gotten officially recorded in a publication of a pancreatic extract, where you can see that MacLeod was not the team, but he was supporting. And these are all the figures that you can see here. And look at this. if you can see, I don't know whether my pointer is visible, but look at this 23rd, the sugar was, the sugar in the urine was 71, the sugar in the blood was 5.2, that means 520 milligrams. And the Rotheras test for ketones was positive plus, and 20 cc of the extract was given. First, initially 5 cc in the morning, 20 cc in the evening. And the second day, next dose received, and technically ketonuria disappeared. The sugars, they came down. This was the official publication which was there. This is the injection of the first photograph. This is the first syringe which was used for the injection. The discovery of insulin was declared. These are the records of Leonard Thompson's case papers. And for the first time ever, the outcome, the result was improved. This is the way the residents wrote their notes. As we were the residents, we used to write on the same way. Now look at the resident case papers and the way they wrote the notes. But ultimately, the discovery of insulin happened. To name the term insulin, again, initially Freddie and Best decided to label this as iletin. But then it was again JJR coming into the picture, says that, let us go global. It has to be a multilingual ease of use. So let us go to our Latin roots back, and that's how the name insulin has come up into the picture. And for the first time, this was a publication where the name insulin was officially used for the discovery. 3rd May, these people presented this paper again to the Physiology Society, and people like Freddie Allen, people like Jocelyn were again present, and this time these people got a standing ovation and the world got insulin. They became heroes overnight. Remember that the mass production kicked off very rapidly. Salutes again to the magnanimity of these two geniuses, where they sold the patent to University of Toronto for just $1, saying that discovery doesn't belong to us, it belongs to masses. This is not our invention. We don't want to charge. Imagine. This is what is. This was a telegram which Freddie and MacLeod received from the Karolinska Institute of Nobel Laureation. This was a picture of Nobel diploma that they got. So friends, finally, insulin, a very unique drug, a drug that I love, I am in love with. A drug has got a unique features. A drug which got its name even before its discovery. A drug which is the first protein ever synthesized outside the human body as amino acid sequencing. The first synthetically synthesized protein is insulin. The drug which got the quickest Nobel laureation. The discovery was in 1922, 1923 they were bestowed, quickest of the Nobel Prize was given. And Freddie Benting even today till is the youngest doctor to get the Nobel laureation in the entire health industry, even today. And lastly, and very, very important, is this was the drug where no human trials were conducted, there were no phase 1, phase 2s. The emergency approval was given even before conduction of the trial. The drug was already in the use before the approvals. Exactly same thing happened for COVID times, and we kept on criticizing the authorities. But this is what the need of the hour is. So I'll end up my talk by giving you the answers of what difficult questions that I asked. This is for the residents, that 1 unit of insulin is 34.7 micrograms or 28 units per milligram. The daily human injection from the pancreas basal secretion is around 40 to 50 units, which can go up to 200 units postprandially. 1 unit is defined as the ability of the insulin to reduce down the blood sugar by 50 milligrams or more. And for the first time, the credit goes to Dr. Henry Dale, a physiologist again from Scotland, who gets the credit to start standardization of insulin into units. This is Toronto General Hospital, 2009. I shot this when I went to Montreal for an IDF. I saw to it that I visit this place. On the 12th and 13th floor of this hospital, there is a beautiful museum which is available. If at all you get a chance to visit, go there. You'll realize that Freddie, Best, they still live. They are there. they have truly become immortal. That has become a place of tourist attraction. What happened to our geniuses? Sometimes later, they continued their work even after the insulin discovery. One prominent work by Best was the discovery of heparin. One prominent work of colleague was the discovery of the other endocrine hormones like estrogens and progesterone. They played a huge role. I'll sign out now by saying that insulin is the remedy primarily for wise, whether they are patients or doctors. Everyone knows that it requires brains to live long with diabetes, but to use insulin smartly, it requires more than brain. Professor Jocelyn, thank you very much.